Hello IVCC students, as well as other people that might be watching this on my YouTube channel. I thought we would go into the rest of the semester through this pathway with what's going on with the coronavirus. Make sure, you're keeping yourself safe first and foremost. So if you are somebody that has to go to work, minimize exposure as much as possible. If you are somebody that takes care of elderly, same thing too. You have to minimize your exposure to others even more if you're trying to, be around those people. So take care. Wear your PPEs, right? We got our gloves when we're around people, handling people. We can wear a mask. I'm speaking weird today again. You can wear a mask, but again, basic thing, keep yourself safe. Limit your exposure. If you have questions, contact your local authorities. They'll be able to tell you a lot more about where you can go and what you can do. Let's get into what we've been learning about so far this semester, right? So we got over the 6 different types of injuries. The assignments look great, spot on for what I'm looking for, good material, good information. I want to make sure you guys know this stuff. We had our different types of wounds, so let's go through those 6 types one more time just to catch back up, and we'll get back going. So again, open wounds. We're looking at open wounds. With those open wounds, we're looking at number 1, a minor abrasion. We had lacerations, avulsions, we had amputations, we had puncture wounds. You could say a penetration wound is the same thing. And we had those crush injuries as well. We went through the basic care, right? We know that we check the scene for safety, we check the person, we call 911, and we care for injuries found. If it's an injury that we feel like we can take care of and it's minor, we don't call 911, we just go ahead and take care of business, right? We apply pressure to the open wound. We determine the source of the injury first before we touch anywhere. If we cannot tell any of those things, especially if the person's conscious, right, we have to get those allowances. We have to ask if we can help them. Make sure you have your first aid kit, right? This is going to be key. This is going to help you a lot of times with those basic injuries. And wearing your PPEs, of course, is going to help protect you. But having a big supply of these things like gauze, like roller bandages, they go a long way for you for the basic wound care. And we know we have to clean wounds. Once we've made sure that they're clean, then we go ahead and bandage those wounds when they're dry, checking them out every 4 to 6 hours usually, or looking for signs of infection. Let's go back into now the book. So you're just going to keep skipping ahead into soft tissue injuries part 2. This is the musculoskeletal injuries. So we're going to start with wounds to, what is it? I guess you could say the upper body, or sorry, the lower body, and then we'll move to the upper body a little bit more then too. For these wounds, let me get to where we are on our chapter. There's a picture in your book, and it shows a baseball player. It shows a baseball player getting hit directly with a baseball. Okay, so we have a couple different types of forces that can be applied to cause these musculoskeletal injuries to the body. So if you're a baseball coach, you observe any sport, these are very common injuries. Go ahead and go onto YouTube. I'll try to make a post of a video, but you could see some sports injuries, and sports injuries can be very, very gruesome, and they can be very painful. And we may be that one person that could be there to call 911, right, when that person's in agony, to control the situation so no other injuries occur, to help that person get off the court so the game play can continue. So direct force, right? Something hits you directly. A baseball hits you into the ankle. The baseball hits the child in the chest, right? That could be a scary situation. It hits the child in the chest. The kid falls down unconscious, no motion. What do we do, right? We call 911 immediately because that's something that's very life-threatening. Now, an indirect force would be something where, say for instance, you are running down the court playing basketball, you jump, and as you come to a stop, your knee buckles, and you hear a pop sound, or the person that has the injury happen to them, they're in an extraordinary amount of pain, they fall to the ground. Okay, you heard it maybe. Okay, an indirect force is when an injury comes from a result of maybe slowing down impact. Okay, there's a picture in your book of a guy riding a horse, and he falls down and he uses his hands to brace himself. The hands work, yeah, absolutely, but then his shoulder disc pops out of the socket because of the indirect force coming through. He couldn't handle the pressure of it. I have experience with this too. Maybe you guys do too. And then moving into twisting forces. Twisting forces, maybe somebody's knee buckles, but they're twisting as it happens. Or maybe they're just in the air and they get twisted. A shoulder, right? A shoulder gets twisted. It becomes dislocated very easily. That can be something very painful and very damaging to the bone structure as well as the joint structure. Let's go through the two types of fractures to bones now. The bone fractures would be, for instance, an open versus a closed fracture. So an open fracture means that the skin over the fracture site is broken. You're going to see blood, all right? That means you're most likely going to see bone too. Okay, this is very important that we call 911 immediately for this type of injury, and we do not move the victim. We immobilize the victim as much as possible. We do not try to realign anything. For a closed fracture, again, we could see some mild distortion. The skin will not be broken, no blood, right? But there could mean that there's damage to underlying structures other than just bone too. So again, we do not do anything but call 911 if it's necessary. If it doesn't seem life-threatening, if there's good color to the joint, right, we can just go ahead and sit the person down, immobilize the joint, transport them to the hospital, or again, call 911 if you feel like it is a life-threatening situation to get some help. Dislocations, okay, dislocations are common in that twisting force of actions. That can happen in a shoulder very easily compared to like something like an ankle, right? We can have finger dislocations pretty easily because they are more susceptible to injury, being separated and small. We have shoulders because they are so highly mobile. We could also have elbow dislocation, very easily so. But then we're looking to other ones that are less common, for instance, like a hip dislocation. Strong force is necessary to make that happen. Elderly population is more of a likelihood then too, since they have weaker joints. Knee dislocations are very highly likely in sports possibles. High impact injuries, well, I should say indirect impact injuries are a result of a lot of sport knee dislocation. So if you've heard of an ACL tear or MCL strain, this means that the joint has been compromised. Let's move into sprains. So it's good to know a sprain versus a strain, right? When you strain to work out, you're straining your muscles, okay? When you sprain something, you sprain your knee or you sprain your ankle. A sprain means that you're spraining ligaments, and ligaments are the tissue that connects bone to bone, right? They're not having force go through them other than to prevent movement at the joint site. No sliding force, no tensile pulling, no twisting. It's trying to keep the knee solid, right? Crucial. They're crucial for stability. When we look at a strain is going to be when a muscle, right? A muscle tears or is stretched over time to a point where it's causing injury. A sprain, we sprain our ankle, right? So let's go back to that. When somebody sprains their ankle, you are completely tearing or you are stretching those ligaments and maybe some other tissues of that joint. It's very important that we try to have that person relax that injury site after this happens. A strain again is going to be with a muscle. We strain our back. We strain our back muscles. We can strain our hamstring if we're trying to run too fast, or quadricep. You could strain your calf muscle, right? Maybe you could even strain something like your bicep. Okay, there's a lot of the muscles you could really strain. So a muscle strain, right? A muscle is torn, a muscle fiber, it's a tendon, or the fibers themselves are torn or overstretched. And this could be from many things. Again, this could be overexertion, right? You're trying to pull too hard, maybe with a bicep curl. I've seen a bodybuilder do this. I'll try to send you that video too. Just doing stupid stuff, right? You're trying to lift way too much than what you should be capable of doing. People are more likely to injure themselves in the first beginning portions of doing something very vigorous or very intense versus later on, right? Signals for serious injuries, right? What are our basics when we have a serious injury? We hear something pop, right, in the distance. We hear a crunch sound. It's painful then for the person to move it, or even sometimes painful to the touch. Those are pretty good signs. If we hear a snap, not just a pop sound, that right to a bone, that's obviously very bad. The person's howling in pain, right? Maybe there is a significant deformity where the shin is displaced sideways, right? That obvious fracture, you can see where the bones are just, you have an extra, it almost looks like you have an extra joint, right? It's pretty bad. So we want to make sure we do think of these injuries as serious. We call 911 as soon as we figure out this. We're looking at numbness, we're looking at discoloration. The joint, or you could say the whole limb could be cold, or it could be tingling. This could be compromised to blood flow. This could be compromised to nerves as well. I had a video to show you guys, but we'll try to get to that some other time then too. Moving forward, obvious deformities, right? Anytime we have those moderate to severe swellings, discolorations, we heard our pop sound, we heard a snap, the person maybe is losing a lot of blood, right? Or if the person has a head, neck, or spinal cord injury, we're afraid to move them, they have trouble breathing. With any of these musculoskeletal injuries, we want to call 911 immediately. We're not going to joke around here. We're just going to go ahead and call 911, keep this person as comfortable as possible in the position that we hopefully found them where it's safe. For the more, let's just say for the easy injuries, I twisted my ankle, right? The kid got hit by a baseball in his arm, right, during the game. You pulled a muscle maybe, so you're going to sit out a couple weeks because, you know, usually muscles need time to recover. We're going to follow the Rice method. Now, you've probably heard the Rice method as rest, ice, compress, elevate, but we're going to change that a little bit here, so make sure you do write this portion down because this is a very good test question. The Rice method stands for rest, number one rest is R, I is immobilize, C is cold, so C is cold, and then finally E is elevate. So let's think about this in a pattern here. Rest, number one, rest. Rest depends on how severe the injury is. So if it's just a mild, I twisted my ankle, I can still run around it, no problem. You rest maybe that day or less than maybe you can get back to activity that very moment. Rest could be 2 weeks to 2 months. I mean, it depends. If you tear an ACL, rest means you don't move because your knee is severely compromised. You have a torn ligament, your knee's not stable. Rest for a muscle, it could be 2 weeks, it could be 2 months. It depends. How bad did you strain that muscle when you tried to exercise it? Is it completely torn? Is it just partially? Is it just a mild thing? Then you can rest. Yeah, put some ice on it, rest a couple days to a couple weeks. If it's something severe where it causes you discomfort, pain every day, go see a doctor. It's pretty basic. You're going to need an orthopedic surgeon, maybe do some repairs or at least scan the body to understand what's really going on. So rest, number one. Immobilize, right? We don't move it. We keep it from moving. We don't exercise. We don't go to the gym thinking we need to get our gym in there, session in there, or we're going to lose our gains, right? Let's take care of the problem. Let's immobilize the joint, immobilize the injury site. Cold, right? We put cold on it. So ice, that means. We can put ice on it. We can use a barrier with an ice pack. We want to make sure we don't overly cold, put too much cold therapy onto that tissue because, again, we can cause the skin to actually frostbite or burn. So we want to be very careful as we don't have direct contact with ice packs. And then elevate. Elevate is going to be beneficial to help circulate lymph fluid or blood vessel leakage. You can also say then too, anytime there's damage, there's going to be leakage of blood. Tissues are going to be slightly compromised, so the lymphatic system is going to pull that excessive fluid and excessive debris back into the bloodstream and get it out of the body. So elevation does help that process. So rest initially, rest continuously. Immobilize right when it happens. Immobilize as your healing process goes. Look for therapy with a doctor or whatever those things are. Cold, we put ice on it, we chill it. 15 minutes at a time is usually pretty good. 15 minutes on, 10 to 15 minutes off. You want to feel the tissue be cold and then re-warm. What's happening there is you're doing an influx of hot to cold, right? So the tissue is very hot because it's inflamed. It's trying to heal itself. You put cold on it, it flushes all the heat out, right? It pulls all the heat out. And then as you take the cold away, it rushes all the heat back in. So in and out, in and out, in and out. We get that pull of debris, influx of good nutrients, pull back and forth, helps with inflammation, helps with swelling, all those little attitudes. And elevate, last but not least. We don't want to elevate if it causes more pain, pretty obvious. But if we can elevate the injury site like an ankle, right? We prop it up on a pillow, have the person lie down with ice pack on it. That should be pretty good. So that'll help reduce the swelling. Splinting, okay, so word of advice for splinting. Okay, if we're going to splint an injury site, that means we must be transporting that person, okay? Say we don't have a professional responder helping that person, like an EMT, we're going to move that person with a splint, hopefully, so on their injury site. So if they broke their forearm, right, we want to splint that. We want to take something at least like, I mean, I know it doesn't work too well, but this is an example. You can make a rigid splint, a semi-rigid splint out of even just paper right here. So I just took some newspapers, and if I fashion, right, if I tie here So say the injury site is here in the center of the forearm, midline. We move towards the distal end. We can tie a knot here. We move towards the proximal end. We can tie a knot here. It's going to be supported on the arm. Now this person's arm doesn't have a chance to bend there at that portion anymore. Of course, don't tie too tight, just tight enough to hold it in place. That way they can hold this, and look, my arm's completely rested. Now I don't feel as much pain. I'm easier to transport. A splint works well. So simply enough, right, you have your triangular bandage. You take that triangular bandage, 2 of them. You got a rope now. You tie it around the arm, right? This portion of the injury below, and this part above. We don't want to go directly over the injury site. So above and below, and then we also do our capillary effect to make sure we got good blood flow still. Now sometimes we might have to make a sling, but we'll get to that a little bit later. So splint for now. And you can make something rigid out of even newspaper. Look, your book that you should be looking at right now has a great, you twist it, solid, perfect for that. Perfect example of how to make a nice splint for an arm. Other things you can use a piece of wood, right? You can use, what else? I have household items around here. You can get a ladle or a spoon, right? A big one for stewing stirring up vegetables or something. You can really use a lot of things as a splint. Okay, as long as it's a long object, solid object. Now, if you try to splint the injury site and it causes more pain, don't do it. There's no point in splitting something that causes more pain. You're better off just waiting around for the medical professionals to come help that person. If you do use a splint, remember, splint injury in position found. So leave it. Don't try to move something back into position that you think it should be in. No, try to keep it in that position found so it doesn't hurt them anymore. That could cause more injury trying to put something back in place and you don't know what's going on without an x-ray. Other things then too, right? We want to make sure we check that circulation. Let's see, going forward. So ice, like I said, 15 minutes is good. You can go up to 20 minutes if you want to put ice on something to help with swelling. 20 minutes is good, but no more than that. Anything longer than that, it's not useful. You're better to rewarm the tissue for half an hour and then put it on again. And again, if you're going to elevate, do not do it if it causes more pain. Elevate only if it does not cause more pain. We're going to jump into musculoskeletal injuries 2 and splinting. So with that being said, okay, the reason we're trying to immobilize, we're going to do that for some purposes. 1, if we need to move the person, right? 2, if it's going to be to prevent further pain, damage, or lifelong disability. We're also going to go ahead and do some prompt care right away because we want to make sure nobody gets maimed in the process, right? So we want to make sure we take care of them as much as possible. Immobilized is going to be good to help, again, lessen pain, prevent further damage, reduce the risk of serious bleeding, right? That's another reason to immobilize. Reduce the risk of serious bleeding. We're going to possibly reduce the loss of circulation, right? And then we're also going to prevent closed fractures from becoming open fractured by immobilizing. So, right, you have a bone that's broken, and if we move it some more, it can actually make that bone stick out. Now we have an open fracture, way worse. So immobilization can have its perks. Especially if you're in a wilderness, right? Wilderness scene, and you got to walk that person out of the woods, you're going to want to splint that item, especially if it's an arm. Moving into some more things, signals of serious extremity injury. These are the basics we need to always know. If you have severe pain and tenderness, if you have swelling or discoloration, right? We have an obvious deformity. The person can't move at all, or they can't have any use of it. Maybe they can't even move their hand or something. They have a severe external bleeding, no feeling at all to the joint. If it's severely cold to the touch, these are going to be those serious ones where we hopefully can call 911 as soon as possible. General care for all upper extremities. So we're looking at the arms. Okay, we want to stabilize that body part in the position found, right? And if there is external bleeding, we want to apply direct pressure to that wound, right? So you get our gloves on, we use gauze, we apply direct pressure with that combination onto that wound site, control the bleeding first and foremost. If it causes more pain, right, we have to be very careful then with how we're applying pressure, especially if there's a fracture going along with it. So for fractures, apply pressure around the area instead. Like say, for instance, there's a skull fracture, we don't put our hand directly on it with our gloved hand, we go around it more or less, create a barrier around. Let's see here, other things then too. You can use a lot of structures to help prop up an injury site. So you can use a pillow, you can use a blanket, you can use a lot of different objects. Even a sweatshirt can be beneficial to maybe lay underneath somebody's arm to help maybe feel more comfortable if they broke their arm or something like that. Whatever works in the heat of the moment, that's the best thing to go with for helping with pain. And again, splint only if the person must be moved or transported. It does not cause more pain as well. That's another good reason. So let's be safer overall. Let's move into the specific types of these portions of the body. So the specific portions, we'll start with the first bone here called the clavicle. Now the clavicle is very frequently injured because it forms two joints. It has one joint here, which is the sternoclavicular joint, sternum and the clavicle. And the clavicle is an S-shaped bone that comes out here towards the tip of our shoulder. And then we have the AC joint, the acromioclavicular joint. Very obviously signs where they could get injured, right? You have an outstretched arm and you fall on it. Arm comes back and dislocates. Or just the pressure right here of getting hit. That can actually cause it to break either here, the split, or split here at the more distal end. So clavicle injuries are very common. Falls, right? Somebody falls with an outstretched arm, falls or gets hit. The scapula is less commonly injured, and that's going to be the bone right here, and it runs along our most posterior portion of our upper back, the scapula. This is where most of our back muscles adhere to, is the scapula. Now the scapula is less common injured, more commonly cite the AC joint, and we can usually see that. If somebody hurts their shoulder, you can see a separation where this is sitting up a little higher here or here compared to the other side. So we can always do a bilateral comparison and actually feel, even gently touch. Do they feel the same? This one feels higher, and this is the injured one? Oh, we might have a separation. We can see actually the injury site. Painful? Yes, usually very painful for these peoples. So again, clavicle injured more oftentimes, scapula along the back, very much so less common of an injury for that bone. But if they did injure it, they'd never be able to move their shoulder at all. It's more common to see an injury with the humerus, which sits within, okay, the glenoid cavity, and that's the cavity of the scapula, the little depression where the head of the humerus sits to allow us to have such great range of motion in our shoulders. General care for any kind of shoulder injury, so we're looking at clavicle, right, shoulder. Anytime this causes a lot of pain, the person has the muscles tend to tense up and hold that arm to protect it more often, and that's just going to make the whole healing process a lot harder. Right? We want that person's arm to hopefully relax as much as possible and sit there. So that's why, first off, if we can make a nice solid sling, assuming there's good blood flow, right, and it doesn't cause any more pain, and it's not life-threatening at this moment, right? We can go ahead and manufacture a sling, and this will hold the person's arm into position so it'll actually feel a lot better, per se, for a little bit. So let's get into this. Let me show you a bandage that we could use. I'm going to back up a little bit because I don't have much space to work with. All right. So if we're going to be working with a bandage, go ahead and grab your triangular bandage, your triangular shaped bandage out of your kit. I know you probably haven't even broke it out yet, and we'd normally be using all mine, but giant triangular bandage, right? I'm holding the long end, and I'm holding the short point in this process right now. Now there's a couple different ways you can do this, and it doesn't really matter too much because you can always retry and put it back on, okay? But I'm going to go ahead and say, okay, the person is going to be wearing this like a toga. I'm going to do this on myself and show you just how pretty easy it can be. You're going to have to get a little personal, right? So in this time of the age, you need these gloves on if you're working with somebody. But you might have a kid around, you might have your husband, your boyfriend, whatever it is, your grandma around. Ask them to be your practice dummy today. Okay. Here's our practice. Let's say I severely hurt this arm here, my left arm. So in order to put this onto my left arm, okay, I want to create a cradle. And the easiest way to create a cradle is to make sure that the elbow is propped or pushed up or slightly elevated just to allow all the muscles to drop and relax. So this is me holding my arm up with my shoulder, my muscles, and this is me holding it with my right hand, and now I'm completely relaxing the muscle. It feels so much better. That's what we're going to try to simulate with this bandage. So put it onto the person like it's a toga. So they're going to be probably cradling their arm. Let them keep doing that because that's going to help you out a ton. They can always maybe hold it out a little bit to get you in there. but you're going to have to go ahead and get a little invasive, right? You're going to take the long point, okay? You're going to take the long point. I'm going to try and play with this with just one arm. And I'm going to put that up through the armpit, right? And I'm going to go ahead and set that on top of the person's shoulder. I put it underneath their arm, right? It's underneath their arm right now. Okay? Now I'm going to take that point and I'm going to put it on into their hand right there. That's going to be your position. And then you're going to want to go ahead and finagle this a little bit so that way it's as far as you can go across the chest. Everybody's built a little bit different, so take your time. Then you're going to want to make sure that you have this end around the elbow, and you're going to want to lift it up here. Okay, so you have the toga, right? The toga pointing away from the injury, pointing away from the injury, just the injury. Get the point there, place it around the chest. You take the one that's here, and you're going to make this sure that this comes around their neck. So I'm going to move mine down a little bit. Mine's really long. Good. Do that again. One around my neck, around my chest, here, perfect. I'm going to take my other one that's in front and make sure it's around that elbow. And I'm going to go ahead and give it a little tug when I get there in position. Now, bear with me, I'm doing this with one hand. Okay. And I'm just going to go ahead and hold it and show you that, look, I just made myself a sling by myself. It would be more appropriate if I had somebody help me to tie this, right? Which is what we're going to do. But I'm letting my whole arm just hang there dead. This is dead weight right now. That's what we're trying to facilitate, dead weight. Now you can do it this way, or we can flip it around the opposite direction, right? If we feel more comfortable, we can take this end, we can put it here, we can take this end, come around the elbow, and around the person this way. It's really up to you. This one works as well. Not as good to me though. That's why I like the toga method. The toga method works well. Toga it across their body, have it point, right? Make sure it's in position. This one's across their chest, all the way across their body. One in front, goes here, around, hold on tight, and tighten it as need be, and it's relaxed. How good is that? Another thing we can do is we can create a binder around their body, right? So if I had a second bandage, if I ever want to take a bandage, I want to put it around somebody, I can put it around their body like this. So I got the injury site here. And I can tie the injury site right here. So they got their sling. Imagine their sling is here. Now they have it bound to their body. This is called an anatomical binding. You bind a body part to another body part. And that way their arm doesn't have the likelihood to swing out if you have to get in and out of a car or something like that. And then people also see more of this, right? If they see a sling going on, they're less likely to touch that person or bump into them. They're more likely to part ways and let you walk on past. So you're not going to worry about injury as much. So very useful, these triangular bandages. Look for irritation on the back of the neck too. So pull the hair up, right? Tie it in place. And then maybe take a roller bandage. You can stick that just behind the knot. That way it's more comfortable for the person because that can cause irritation. Again, the force is going here instead of through here where the injury site was. So that's real good. Let's stick with that. Stick with making our slings and splints. Make that be your homework. So you practice this with your kids, with your family members, whoever you are allowed to be around right now. Practice on yourself. You can always work on your lower limbs. You can always try to do something different like that. So upper arm injuries, let's move to that real quick. Upper arm injuries, looking at the shoulder, the humerus in particular, the head of the humerus, that's the head of the upper arm bone, down the shaft, and then we get to the elbow, and the elbow is going to interact, it's going to have the humerus interacting with the ulna and radius. So radius is thumb side, ulna is pinky side, right? A little bit of that. So thumb, radius, ulna, pinky. Move on down, humerus, and that's going to go ahead and get into that glenoid cavity with the scapula. The humerus can be fractured at any point. For instance, my brother, he got tackled playing two-hand touch football, right? He got tackled. Anyway, he was only about 6th grade. He got hit to the ground, and it broke his humerus right here just below the head. And that position, okay, when you are in 6th grade, that is your growth plate. That is your epiphyseal growth plate. And this growth plate, right, if damaged, it can sometimes hamper the growth of that bone forevermore. It is crucial that you seek medical professional help immediately to put that bone back in place, because that plate needs to heal even better, because that's where the bone, again, grows for length. His arm is actually just a smidge shorter on his left compared to his right arm that was not injured in that accident. So it's kind of interesting. He had, in that case, had just a soft sling like this basically, and a couple other things, because they could not cast him. It was so high up in his arm. But most of the time they do cast this bone. So again, it can be fractured at any point along the way, even the elbow itself. It's probably going to cause a deformity. It's good to go ahead and call 911 if it is life-threatening, but again, we should go see medical professional help immediately, even more professional help too, like orthopedics, to help heal those injuries. Again, we are only trained so far, right? Bumps and bruises. We should recommend medical help further on. Upper arm injuries, there's a good picture in your book, like I was telling you, for some of these things. Like there's the sling picture, the girl with the sling and the binder around. Furthermore, there's a picture of a guy that looks like he's got an elbow injury, so he's actually got a splint running from his upper arm down to his lower arm. So it's splinting his elbow, keeping that straight, and then putting it above and below the joint is where we're tying that splint in position. Then, because it's just easier, you can bind something like that to the person's body, because you can't bend it, you can't lift it up. You're going to want to keep that at their side. Elbow injuries, these can be very painful, right? So it may not be good to splint it if it's in a bent position, because we'd have to move it, right? It may be better just to maybe put something to rest underneath of it. Maybe a splint would work in that case, but what I'm thinking more along lines is we need to let that person cradle it and hold it. That's going to be the best thing, because they're going to know where the pain is and what's going on. And usually times when you hurt your elbow, you pull it in. Unless it's hyperextended, a little different story. But again, they're going to be cradling it. So making a sling would be very useful in this moment, or calling 911 if it is life-threatening. These are very, very common in a fall injury for people's. Care for elbow injuries in general, right? Splint as needed, like I said. Make sure that we are not causing any kind of excessive pain. Let's move on to the forearm, right? Forearm. So again, I flip my hand around. I go ahead and look at my thumb. My thumb is the radius side. My pinky is ulna side. So the forearm bones, they interact with each other. These are commonly injured from falls or elbow collisions. So again, you can crack and snap your bone in half. Kids do it on skateboards all the time, things like that. But again, you're going to see an obvious deformity. You're going to look like there's almost an extra joint sitting somewhere where there's not supposed to be a bend going on. Obvious pain. They're going to be in shock of it, probably, of what happened, because they're going to be seeing it right in front of their eyes, going, what happened? If you try to stop yourself from falling from an impact, you can have indirect force where the small bones in your wrist, your carpal bones, they can get broken, but they can actually push into your radius, for instance. The radius is going to have a lot of force coming through it when you try to stop yourself. So they can actually crush the radius head. There we have a crush injury. And we haven't even talked about things falling on it. It's just you falling on yourself. You can have a crush wound, crush a bone, just from trying to stop yourself. Let's see here. Now, there could be a loss of movement, right? If we break a forearm, obviously, or hurt a forearm really bad. There could be severed nerves, there could be blood vessels damaged, there could be severe bleeding from a fracture, because these are very thin skin overall, and there's a lot of blood vessels and nerves, so this could be very damaged. Call 911 if we see something serious like that happen. Serious ones, right? Moving down to the wrist, right? We can have a dislocation of a wrist, we can have a broken wrist. We can also break the hand bones, so these would be the metacarpal bones, and then we can break the phalanx, or the phalanges in general. So a phalanx is just one. But anyway, we could break a finger. These are very commonly dislocated or broken. Chiropractic, if we want to go ahead and splint something like a hand, right? We can splint it flat. Or if it's more comfortable for the person to have it where you found it, maybe you can put like a bandage into their hand, right? So that feels more comfortable. So that way when they rest their arm, it's going to feel better versus trying to hold their hand open that's just been broken, right, on a splint. You could even take like a tennis ball or wad up gauze, and they can just hold it, and then you can wrap it around, at least so it maybe feels more comfortable in the heat of the moment, being like this, right? Versus their hand's broken and they don't want to go there. They want to just let it stay completely relaxed like that. You know, think about what could fit in there, so it helped them reduce their pain. So hands, right, we be careful as possible with that. Wrists, same thing, keep them aligned, so neutral or position found if it's more comfortable, right, obviously. Let's move to the fingers. A popsicle stick, a pen, you can tape anything like that to a finger to keep it straight. But a good rule of practice is you can go ahead and tape like Spock says. You can tape these 2 fingers together, you can tape these 2 fingers together. Anatomical splint right there. You're using another body part as a splint. You don't want to tape this direction, because if you tape these, and say for instance it's a football player and he got these 2 fingers splinted together and he's playing and he's pushing people, this one's hanging out all by itself asking to get broken as well, so then you're going to have 2 problems going on. Let's go ahead and just focus on these 2. We'll put these 2 together, we'll put these 2 together. Never this way, always this way. That looks like a Y for yes. Can you guys do that? Try it right now. Work on your ambidextrous stuff. That's the hard one right there. Lower extremity injuries. We might as well jump into that today too, because like I said, we're gonna fly through this stuff compared to what we normally do in class, just to keep you good. Thigh injuries. Okay, we're looking at the hip bone, the pelvis, and we're looking all the way down to the knee. But a thigh, that's actually the widest point of your body. Your hips aren't wide. Well, your hips are wide, but there's a thing they call the greater trochanter on the femur. And that's traditionally the widest point on the human body, not just the pelvic bone. Anyway, enough of that. The femur is the longest and largest overall bone in the human body, and that's going to connect up to the pelvis, the pelvic bone. That's 3 bones all put together into one. We call that just the pelvic bone. But it's one solid bone in a unit, you could say, with the sacrum intertwining with it. We rarely ever have hip fractures. It's more oftentimes from an older person taking a fall, somebody taking a very painful, severe fall, like a high skateboarding fall onto concrete. But it's usually a direct force with these. Indirect are rare. I guess somebody could be running, like, look up Bo Jackson, amazing football athlete back in the late 80s, early 90s. One of the best running backs of all time, 2-sport athlete. He could wall run and catch balls. I mean, he was just fantastic. Humongous, strong athlete, fast. He was running full blast, and he hyperextended his leg, I think, or something. And anyway, the force of his femur head going through his acetabulum, through his pelvic bone, ball and socket joint, it caused the head of the femur to dislocate from that big round surface and pop out, which takes incredible amount of force. It's a very extremely rare dislocation. And he was done. He could not play sports like he used to ever again. Life-altering kind of injury. For something like this, we want to make sure we do call 911 for a very severe. Anytime there's severe pain, agony, the person can't move, the person is older, all right? We want to call 911 immediately for these kinds of upper leg injuries. There's a lot of very big blood vessels working through here, and a lot of big nerves working through here as well that we want to take care of at the same time. The femoral artery can get injured. So that's that big blood vessel we're talking about where we need to put direct pressure on, and then pressure at the pressure point, which would be just proximal to the wound. If there's somebody that's having severe femoral arterial bleeding, they're bleeding out from their thigh, right? You stick your knee into their thigh and put direct pressure on the wound. We'll go over tourniquets later on too. That's something we still need to get into. But femoral bleeding, this is life-threatening, right? We call 911, we put pressure on the wound immediately, all these things. Hip fracture, life-threatening. Signals of a fracture, though, to a femur. Okay, so femoral fractures. One looks shorter, one leg looks shorter. The bone could be sticking out, one leg could be turned outward or inward. There could be severe pain going on. They can't move the leg. Like, these are all definite things that could be going on here. We don't need to try to splint a femur injury like this. We leave those off hands. The only times we're going to splint is when we're looking at more along the lines of knees and lower limbs for these extremities. So thighs, don't splint a thigh. Call 911. Care for thigh injuries, though. After we've called 911, we'll stabilize them in the position we found. We can keep them resting, keep them comforted that everything's going to be all right. Shock could come in, right? They could have broken their femur. They're bleeding, nerve damage. Organ systems could be shutting down. They could be freaking out, right? that they broke their leg. There's a YouTube video of a guy playing soccer, and he gets like checked, and his femur's sticking out of his thigh, and he's still running around on it like, oh, look what he did to me. Look. Well, obviously, like, sit down, man. You're gonna kill yourself doing that. You need medical attention immediately. You need to rest, and you're gonna be out of commission for a while, but he's still running around. I'll try to find that video for you too. But other than that, ice, right? Ice for the time being while we're waiting for 911, and from there we can go move down to the knee injuries. Knee injuries are more common overall. Knee injuries happen from people playing basketball, golf even. You can injure your knee, to hopscotch, dancing at the club. But what we're looking at is a compromise to the femur end, as well as the upper ends of the tibia and fibula interacting with the patella, which is the kneecap. So we're looking at the kneecap, we're looking at the bones just deep to the kneecap as well. The femur sitting at the top, the tibia just below, and then the fibula on the outside of the lower limb. Basic care though for injuries to the knee, we're going to stabilize in the position found, and we're going to control any kind of external bleeding with pressure first and foremost. Now again, if there's a fracture, we're going to put pressure around that fracture if we see that external bleeding versus direct pressure, because we don't want to cause more pain or make the bone worse. We're going to call 911 if we see something like that happening, and we're going to splint if needed. Okay? So if needed, if the knee feels better to be bent, we don't splint. If the knee feels better to be extended, then we splint it. If we are going to splint, we should probably use 2 splints. One on the outside of the knee and one on the inside of the knee. That would be much more advisable. So again, one hard structure, a plank of wood on the inside of the knee, one on the outside. So listen to this. Inside splint should start at the groin and extend past the bottom of the foot if possible. If possible, that would be outstanding to go all the way down from the groin to the bottom of the foot. This is going to ensure that the knee is straight. The outside splint should start at the hip, and then it should extend exactly well past the foot then too, if possible. We'd like these to go past the foot. That way we can wrap it at the groin, and then we can wrap it as well at the foot, and that'll hold that entire splint that we built in place to the position that we need it to be. From there we can do ice packs, and then again keep them calm. ACL tears are very common in basketball. You can hear this happen usually from somebody starting, somebody stopping, somebody dislocating, somebody twisting their knee, putting a lot of force through the leg from a cutting motion. These are examples of how we can have this happen. Common in sports like football. The main thing is that if we hear it, right, we know there's something wrong. It's a good idea to get this person some medical attention sooner than later. I've had my ACL tear. It hurts like the dickens, I'll tell you that. It's a really painful injury. Not as bad as the burns, but again, really bad in that you have no stability to your leg anymore. You are compromised. It's best to at least notify somebody that you need ice pack, need help for the time being. You're going to need to go see a doctor in the next couple of days, and you never know what's going to happen. It depends on the type of injury again. How severe is it, and what happened? Lower leg injuries, now we move down below the knee. We're moving to the shin bone, which is the tibia, and then outside of our shin bone is the fibula, the thin, long bone. You can break your fibula and not even know it sometimes because there's really not much weight that's bearing through it. The tibia bears the weight through it. So more oftentimes that one, when it's broken, right? Obvious pain, obvious inability to move the leg, lift the leg, put weight through the leg. What we can do is we can go ahead and stabilize them in the position found again. We're doing this over and over again, position found. We can control direct bleeding with direct pressure, and then we can go ahead and call 911 if that injury is severe enough, right? We can make an anatomical splint. So an anatomical splint for this example, you can tape from the knee, above the knee, you can tie them above the knee, and then you can tie them at the ankles, right? You're made an anatomical splint. You've taped the two legs together. I mean, what else can you ask for? If you're gonna have to move the person, that's not gonna be very easy with that type of splint. But hey, we're trying to keep them maybe steady, waiting for 911 to arrive even too. Ice pack per usual. Type of carry for that person, right? It would be pretty easy to do a two-person seat carry. That would probably be pretty decent to do with that type of injuries because it's below the knee. Ankle and foot injuries, we want to be careful with these because there are a lot of small bones in the foot. and we need mobility. This is actually one of the most useful joints in our body besides our thumb joint here, our saddle joint. Our ankle joint helps us move, right? Walk, go from place to place. So we need these to be taken care of. But anyway, injury can be a result of a twisting force or an impact force with these very oftentimes. What we're going to do is we're going to stabilize the ankle or the foot in position found. Again, control external bleeding per usual, and then splint if needed. But the only time we're going to make a splint for this is if it's going to be a soft splint. We're not going to use a rigid splint, a hard splint like we did before with all the other injuries. We're going to use a soft splint. A soft splint would be simply taking something like a blanket, and we're going to fold it so it's maybe like this long and this wide, and we can wrap it around the foot, all right? And then we just secure it in place with ties. We're just going to be making basically a protectant around the foot with the padding. That's all we're doing. There's no need to do anything else. If the shoe is on the person, we don't need to remove the shoe. It could cause more pain. So we're going to keep everything in place the way we found it, right? General rules, some more rules for these splinting, since we're talking so much about splints. Number one, we're going to remove any clothing or jewelry around the injury site first, because that could cause more pain. We're going to cover any open wounds before splinting as well. We want to make sure bleeding has been controlled, right? We don't want to push back any protruding bones back in the skin, right? So splinting may not be advised if that could cause that to happen, because that can straighten things. So we could screw something up. We don't want to try to re-straighten an angulated fracture or something that's abnormal. We don't want to allow the person to bear any weight then through a lower injury site too if it's a broken bone, right? That could be very painful, cause deformities. We want to make sure the pads are very comfortable. So like when I showed you the sling, we want to make sure it's comfortable. Make sure they're comfortable. Make sure we're not eliminating blood flow. So do that capillary effect at the distal points. Don't secure right over the injury site. So if their forearm's broken right here, we don't want to put a bandage here to hold everything in place. We want a bandage here and a bandage here to secure that splint in place. And then if we are going to elevate, right, we do so with a splint if it doesn't cause further pain. I think that's a good place to stop this week. I think next week what we'll jump into is going to be injuries to the head, neck, and spinal cord. So again, homework, okay? Watch this video, obviously, and email me back a comment. Maybe one paragraph, please. A comment saying that you watched the video, something that you thought was useful in the video at least. Practice your skills. Break out your gauze. Break out your gauze and roller bandages. Practice wrapping wounds, for instance, with family members, if you can get that close. Wear your PPEs always. Look through your kits. Make sure you really know what's going on in those. And then practice this. This is the best one. Use your triangular bandage to make splints and to make slings. We'll get into some more things later on. All right, thank you. Have a good week. Talk to you soon.